In our practice, we see a lot of low back conditions. Some of them can be really bad, like disc herniations or spinal stenosis, and a lot of times, more often than not, what we call mechanical low back pain. And I'll often see the QL muscle, the quadratus lumborum, which really goes from the rib cage here to the top of the pelvis. We'll see some other muscles at play as well, but for the sake of this video, I want to just show you what we do with this. We have this really good table that we can maneuver around, and that's what I'm going to show you. Patients just love this table, especially when we're really releasing that low back. So many times you have tight low back muscles, and we just get in there and really work that. So I'm going to untuck his shirt here and get to the muscles there. I'm going to set the contraption here on this table here, but you can see how it just moves around, and I can get him to go down. And for this particular one, the QL muscle, to shorten it and then lengthen it as I really get on there and release it, it's going to be a little more side bending than it is flexion. But this table can flex down to the side. And then we get in there right on that QL muscle. I'm going to bend them towards me. And then I'm going to go in and I'm getting my thumb in there and releasing that muscle. You can probably tell it looks like it feels good, right? And so we're getting in there and trying to release a tight muscle in the back. And you know, with our low back pain patients, we're going to do this for a bit and really target a lot of different muscles. But again, I just wanted to show you the QL muscle getting in there. Very few people have had the sensation, feeling, and ultimately pain relief from getting on this table and really having someone release these muscles for them. So we're going from a shortened to a lengthened position by using this table that we have here and really releasing that QL. So many people have low back pain stemming from this. And then you could even have referred pain. So sometimes you might have pain coming down the hip here, side of the leg. There's a difference between radiating pain and referred pain. Radiating is where it's going to shoot down that leg. It's going to kind of trace down a particular line, kind of disc herniation, things like that we think of. A referred pain is coming from a trigger point. And it's a little more diffuse in nature and coming there. And so a lot of times we'll get in here when we do our palpation to figure out what's going on, and we'll find a really good trigger point in that QL, and we're able to get in there and just really release that for the patient.